Beyond the Pelvis is hosted by Dr. Kenael a pelvic floor PT and intuitive healer, and Laura Haraka, a somatic practitioner and breathwork facilitator. Each week, we explore alternative and holistic approaches to healing chronic pelvic pain and other painful or chronic conditions. Join us and other experts in mind, body, and spiritual healing as we discuss a wealth of modalities ranging from ancient practices to modern therapies that challenge the conventional Western model of treatment. Let's get right to it. Welcome back to another episode of Beyond the Pelvis. Laura and I today wanted to talk about the placebo effect, right? We felt like this was important to talk about because it sort of gets thrown under the bus quite a bit as being a negative thing. But if you look at it differently, and we'll talk about why and how, it can actually be used to hack our way into feeling better. So, hey, Laura.
Hi, Kenael. So it's so true. The placebo effect is so important, and we underestimate how powerful it can be for us.
Mm-hmm.
So I guess first what we should start by talking about is what the placebo effect is and what is a placebo?
Right. So I'm glad that you made a distinction that the placebo and the placebo effect are two different things because they really are. So when they, as in researchers and scientists, are doing any kind of study, they always have to consider a placebo and the placebo effect because it is that powerful. It is so powerful. They have to account for it. And whatever it is they're trying to test the quality of, right, like a medication, they it needs to be so much better than the placebo effect or than the placebo because it does have a really big significance, the placebo, I mean. So the placebo is the thing. It's a treatment, the pill, the substance, whatever it is that participants are given where they think it may or may not have an effect. But the placebo, right? People think the sugar pill. So if there's a study on medication for migraines, for example, the placebo would be the pill, the medicine, the capsule, whatever it is. It would be the thing that people take, ingest. That's the placebo. The placebo effect is what the brain does, right? The placebo effect is really conditioning. If someone takes a pill, their brain thinks, "Oh, you just took something. Now things are going to start happening. We're going to start feeling better. That migraine's going to go away." The brain actually produces the chemicals necessary for healing to occur and for pain to reduce. The brain does it all on its own because the placebo, the thing that was taken, ain't nothing more than a sugar pill. There's nothing in there but sugar.
It's amazing how real the placebo effect is. And like I said before, we underestimate the value of the placebo effect. And some of these medications that doctors give to us, even if they do work, if we believe they're going to work,
It's gonna work.
exactly, it's going to work
It
because
is.
there's so much in belief.
Mm-hmm. Even in studies where they openly tell participants, this is the placebo, guess what happens? They still get better. Even knowing this is a placebo, they still get better versus if they didn't take anything. And when they have studies like this, they have the actual treatment, right? The pill that's gonna take away the headache. They have the sugar pill, the placebo, and then they have no treatment, right? And people would think, oh, the placebo group and the no treatment group should be the same. No, the no treatment group is gonna not really have any effect because they didn't receive anything. The placebo group is gonna have a significant effect. That pill better have a bigger significance than the placebo for it to be considered effective in treating whatever the condition is. And it doesn't have to be a pill. It could be an injection, it could be a procedure. They've done fake like therapeutic ultrasound. They've done fake surgeries where they cut people open, stitch them back up, and they thought, there's a scar there. They must have done something. And all of a sudden, they're like, oh, my range of motion is better. Oh, I don't feel any pain. They did nothing but cut you open and stitch you back up. But the body
Exactly.
produced all the things necessary for healing. Our body is so capable of healing itself, and we forget that.
Exactly. You just mentioned these sham surgeries that have been done, and there was one that was done. It was on the knee where they were going to remove some arthritis and some disease in the knee. And so they took two groups of people, and one had a sham surgery. They believed that they had the surgery because an incision was actually made and the brain believed they had the surgery. So these people started healing and getting movement back in their knee and feeling good again with mobility.
Hmm. Yeah, not much happened there. Our body is so capable of doing more than we think, and we can use that to our advantage. I mean, this happened. There's so many studies on the placebo effect. I mean, you could look up study after study, but it is important to make note that the placebo effect is so significant that they must account for it when they do research. And in order to consider something effective, if they're studying a new procedure, a new medication, a new pill or drug or whatever it is, they have to have significant enough results that are much better than the actual placebo. And they know that. This is something that they've known from the very beginning. And it's nothing, it's not negative. I've heard people say, why go to acupuncture? It's placebo. I've heard so many people mention that. But acupuncture is one of those things where it's almost always effective. Like, and for so many different things, think of something. You can find a research article that says acupuncture is actually better than even the placebo, right? I don't remember how they account for the placebo effects. Maybe they just sort of poke them. Actually, I think they do put needles in places that don't follow the meridian lines and show that it it is effective, but maybe not as effective as if they did follow the meridians. I'm not an expert in acupuncture, so I couldn't really comment more about that.
Well, it's very interesting that you talk about acupuncture and doctors because what came to me as you were saying that was another study that I heard about, which people had had a major surgery, and I believe it was a surgery on their heart, and morphine or pain meds were dispensed to these patients, and one of them was dispensed by a doctor, and another was dispensed by the patient when they needed it. But the ones that were dispensed by the doctor, their pain went down even further and they had less discomfort. And it makes me think of my own acupuncturist. And there's such a power in the provider and what they say that can offer and give someone a placebo effect with a caring provider, knowing you're in capable hands, and what they actually say to you can actually give a placebo effect for healing.
Absolutely. And I'm glad you brought that up because there are different things that can play a role in the placebo effect. Who is around can make a really huge difference. As you mentioned, if there's a medical provider around explaining something, their tone of voice, right? That's the social part of it. Their tone of voice, their body language, the eye contact, their bedside manner can either increase or decrease the actual placebo effect. If a caring medical person comes into your room and speaks to you and sees you as a human being, you might feel better just from that interaction alone. That alone can have a placebo effect.
Like,
Person, a doctor versus a nurse, or a doctor versus an attendant, or someone might have a better placebo effect than someone who's in your brain not as educated, right? It's your expectation. You expect to go to the hospital or the doctor and get better. That's why we go. So if someone caring comes in, a medical person comes in to treat you, already your brain's already producing all the hormones and the chemicals for healing to occur because, oh, finally, I'm getting the help that I need. And the help that you need may be somebody showing up before they even give you the pill.
exactly. It really depends who we hear it from and who we deem has the most understanding and knowledge of what we're going through.
Mhm.
Depends on how much we believe it.
Yeah.
So for me, with pelvic pain, I had multiple providers, coaches, therapists tell me that this was a mind body condition. But
Hmm.
I wasn't really sure to believe it until I heard it from
Right.
a doctor that we're going to be interviewing soon, just to give everyone a little preview,
Yeah.
a doctor in New Jersey that I felt was very capable and very knowledgeable of mind body symptoms. So once he said to me, my condition is mind body, it switched in my brain and I believed everything everyone else was telling me just because he was a doctor.
Yeah. And I think this is why it's so important for medical professionals to be in the wellness space, right? We can't separate it. We can't keep it separated because as you mentioned, the coaches, the consultants, like they all told you all the things and you didn't want to hear it because you're like, you don't know what you talk about, right? And that was a subconscious belief, right? But the medical professional who treats these conditions, they might not even know what you're talking about. They could totally dismiss you, but whatever comes out of their mouth, it's like you take it for fact, whether it's good or bad, right? But if it's good, if it's helpful, you're gonna notice it changes for you for the better. If it's not helpful, you may notice you had a change for the worse. That is the opposite of the placebo effect. It is a placebo effect, actually. It is. It's called the nocebo effect related to pain. It's the negative association or the negative expectations. So if your doctor comes in all mean and has terrible bedside manner and tells you, like you were told, this is the worst I've ever seen, guess how you are going to feel after? Worse than you did before. That's the strength, right? That's the strength and the power of the placebo effect.
Exactly. It happened to me. I went to a doctor for one of my symptoms, which was PGAD. And for those of you that don't know what that is, it's persistent genital arousal disorder, where you're feeling aroused without any type of sexual stimuli. And it's a hard disorder, but it is, I want to say this, it is curable with the mind and belief that you can get better. But what happened to me is I went to a doctor for that, and they told me I had another condition with my bladder. And wouldn't you know it? I would say probably a day later, I started having bladder pains because he told me all these foods I was eating were not good for my bladder. And when I tried to eat them and drink certain things again, my bladder actually hurt. So I actually got worse from going to the doctor.
Hmm. This is why I'm so careful with what I say when I'm with patients and how I say it because I am aware of the placebo and nocebo effect, and I don't want to be the reason for their nocebo effect. I want to be the reason for their placebo effect. Sometimes I will throw something in there, and this is part of like hypnosis too, right? Where you suggest something. And I do that purposely because I'm not trying to trick someone. I just want them to feel better. And I know that I can hack into their subconscious thinking. by throwing in little suggestions here or there. I'm not a mean person. I'm not going to do this to hurt anyone. I'm doing this to help people. But I will throw that in there as a way to help them. I'm planting seeds, really, is what I'm doing, right? I'm saying something in a certain way. I'm really careful with how I say things. I'm saying specific things. I'm going to avoid saying other things because I don't want them feeling worse. I want them feeling better. And I want their brain to sort of remember that at some point because, like I said, I'm planting seeds. And at some point, something might happen and the brain brings that up again. That's the seed now starting to sprout. And it will turn into something and they'll start to feel better and they'll recognize things. They'll be like, oh, yeah, Dr. Siegel did say that. Maybe she's right. Before you know it, they start getting better.
And as a coach and a somatic experiencing practitioner too, I'm extremely careful with my words. Words can change people's lives. One word can change someone's life.
Hmm.
So you have to be very careful as doctors like you are and practitioners like I am in what we say to people because it influences their healing.
Yeah. We're talking about the brain here, right? That's what's so fascinating about this is we're just talking about the brain and the functions of it. We still don't know a lot. They don't even know why the placebo effect is a thing. Scientists don't know that, but they know it works.
They definitely know it works because of lots of research and talked about healing, which is great. And we can have these healing effects from the placebo effect. But there are physiological changes in our body that take place. So it might be worth just mentioning one or two of the other studies that I find to be really interesting. And one of the studies has to do with having a milkshake. I think you know that study, right, Kenael?
Yep.
Yeah. They gave participants a milkshake, and I don't know the exact words on it, but it had a label on it that said Slim Fast, I believe, something like that, and light. And then they did it again and they gave participants another milkshake, which again had a label like full and fatty or something like that. That's not the actual label, but indulgence in a
Mhm.
drink. And there were physiological changes on both participants in their both of their physiologies. And the milkshake was the same.
Right. It was the same milkshake and it was just the labeling. The labeling. One of them had words that was like indulgent, which people automatically like. As soon as
Mhm.
you said that, I was thinking, ice cream, right? And the other one you mentioned like slim or light or fasting or whatever. I'm already thinking like, oh, it's a health drink. It's the same damn thing, but the bodies responded differently, right?
Exactly. There was actually something in the body, and I believe, if I'm correct, it's called ghrelin. And that, and what happens is the levels of that go up to tell you if you're hungry or not hungry.
Satiated, yes.
Exactly. And there was physiological changes in the body with those levels given the exact same milkshake with different labels.
Hmm. And there's a lot less guilt associated too with the one that you think is healthier. You don't feel guilty drinking that, but the one that you're indulging in, right? You feel more guilty drinking that one. The body's gonna have a physiological response to that, and then you're gonna have physical changes as a result. So crazy.
It's amazing. Now, that doesn't mean everyone should go out and eat poorly right now, uh, because the physiological changes are going to be different on your body. But it is interesting because it does prove that there's an effect with labeling and belief that happens in your brain.
Yeah. That made me think of another one too, where they were researching physical activity and they were looking specifically at house cleaners, right? And they had grouped them, and one group, I think they told them that they were meeting the physical activity needs of what a healthy adult should be. And the other one, they basically made them feel like you're not getting the physical activity and you need to go to the gym to get that. And the ones who were told and had the mindset of I'm meeting my daily requirements of physical activity actually got healthier. They lost weight, their waistlines got smaller, their even vital signs improved. Whereas the group that had the mindset of I'm not getting enough exercise, I need to go to the gym afterwards or before or just outside of this physical activity that I'm doing, cleaning houses, they had no changes and they felt worse as a person because they felt guilty. Again, they felt guilty and shame and negative negativity. Whereas the other group felt more positive about what they were doing and their body responded to that.
It's amazing what positive mindset can do to someone.
Yeah.
Mindset is such the key to this whole thing in my mind.
Yeah.
And if you believe in the placebo effect, like hopefully now people will believe in it a little more after listening to us and other studies out there by other people. There is such a power in what our mind and our brain can produce for our body.
Yeah. And just going back to, talking about the social aspect, right? If you have a doctor who's nice to you, you're going to feel better already. Having a doctor versus someone who you feel is not qualified to discuss or talk about your medical condition, um, having a doctor can help you to feel better as well. But even the activities that you do and participate in can act as a placebo effect as well. Just like, the placebo, the pill, right? If we're thinking of the sugar pill, it's not the pill that's making people better because it's a sugar pill. They know that it has no active ingredients in there. It's the act of taking the pill that the brain responds to. Oh, you took something, therefore it must help you to feel better. So you can trick yourself into taking multivitamins. And in your mind, you're thinking, this is going to help me to feel better. This is going to help to reduce whatever it is you want to reduce. This is going to help to improve whatever it is you want it to improve by simply taking vitamins and supplements. You can go exercise more. Your intention for doing this particular exercise or participating in this particular program is to reduce whatever it is you want to reduce, improve whatever it is you want to improve, but you're taking actionable steps. And as a result, your brain is going to take actionable steps as well. And you're going to get better.
So, one other thing I wanted to mention as well is that when someone does give you a prescription for something, let's say you do get sick and there are side effects, some people will see those side effects and the side effects will happen because your brain believes it will happen.
It's expecting it.
Exactly.
Yeah.
It's expecting it. So a lot of times I will tell my clients or even myself and my children, let someone else read it. So I have let my husband read the labels before, so I don't read the side effects that could come, so it doesn't go into my head that
Right.
it's expected to come.
Yeah. We,
But someone else knows about it.
right.
So in
Understand.
case I am having a side effect that I
They
would
know what
need
to
to
look
know.
for. Right. And we practicing or participating in activities, right? Using the
Mhm.
placebo effect on yourself, as I mentioned, could be taking vitamins, taking supplements, anything. It could be a drink, a milkshake, or, I drink Emergency that has vitamin C and zinc and electrolytes and all those things in there. And as far as I'm concerned, I'm taking it because it's going to help keep me healthy and knock on all the woods. I have remained fairly healthy. Right. And it's a mindset, but it's also the action you take, right? Some doctors or researchers or medical professionals will even dismiss the placebo effect, knowing that it's a thing, but they'll say, well, positive thinking or a mindset alone isn't enough to cure certain things, but it's not just the mindset, it's also the actions you take, the expectations. It's a lifestyle, really, right? Any of this to me is a lifestyle. Being healthy is not a thing you do, it's who you are. You have to embrace that. You have to make it part of your everyday rituals and routines. If you have an injury or you have a condition, especially if it's chronic, if you have a chronic condition or a chronic disease or something like that, you have to change who you are. And I should even say you have to. It's better if you change who you are because you do whatever you want. You make your choices, but you will notice things may be better for you if you make the choice to make it a lifestyle. This is who you become. And it's not too late to change that. And that actually leads me to where I first got really, really interested and just like mind blown about the placebo effect. Because we did learn about it in physical therapy school. We have to talk about placebo effect, nocebo effect. And it just blew my mind that, wow, we have so much control. And as medical professionals, we have more control over people than we recognize and we think. And it's for that reason that I wanted to make sure that I am so careful with my words and how I say things and my body language and things like that. And I'm already, an intuitive person that's just very aware. So it was easy for me to choose my words carefully, to be careful what I say and how I say it. And even if I felt like I slipped up and, oh, man, I shouldn't have said that, I would go back and be like, you know what? I said that incorrectly, or, I would sort of correct it right then and there if I could. And if I didn't, I would make sure I come back and address that because I didn't want to be, like I said, to have that nocebo effect on someone as best as I could, as much as I was aware of. But another thing that sort of got me interested again in the placebo effect was the Dr. Joe Dispenza's book. He has so many, but the one that I read and fell in love with was Breaking the Habit of Being Yourself. He talks about your personality as being dynamic, right? You have the certain personality and you think, well, this is just who I am and this is never going to change. According to him, no. And I want to believe him because he's a neuroscientist. He sort of knows how the brain works. So I'm gonna trust him on that one, that you can change who you are for the better. Even if you feel like you're so stuck in your ways, you can actually change it. So breaking the habit of being yourself not only gives some concrete research and data and examples of the placebo effect, but it gives you step by step. It sounds like I'm endorsing this and we got like a sponsorship. But we didn't. I just happen to really love this book, Breaking the Habit of Being Yourself, because it just gives examples. He has plenty more books, and I'm sure that they're all very similar. And then another person, it was a TED Talk. I'm a big TED Talk fan, and I watched one with Dr. Lisa Rankin, who is a OBGYN, as traditional comes, and now she is like a spiritual, I don't want to say guru because some people don't like that term, but she's all about the mind body connection, integrating mind, body, emotion, mental, and spiritual health into a whole person treatment. She talks about the placebo effect in her TED Talk as well. And she recently wrote a book. Oh, I don't know if it was recent, but she did write a book, Mind Over Medicine, which you have personal experience with.
I do. I have personal experience with that book. I decided that I was going to read every book I could find out there about the mind body syndrome. And I read a lot of books that were really good. And I can sit here and endorse a lot of them as well. I love Unlearn Your Pain. I love Alan Gordon's book, The Way Out, plus many of them by Dr. Sarno. And there's just so many. The list is endless. And I've read over 20 books on Audible. And I would take walks and listen to these books. But I came across Lisa Rankin's, and I really found it exciting because a lot of these books don't talk about pelvic pain. And I believe, and I read this a long time ago because I stopped reading as many mind body books now since I don't even know if there's more to read because I've read so many.
Hmm.
And she talks about pelvic pain and what she had to do. And most of these other books out there talk about back pain, fibromyalgia, tinnitus, all different types of mind body symptoms, but there's not one book about pelvic pain. So it was really nice to hear her story about pelvic pain because it resonated with me. To hear someone else that suffered with pelvic pain and she healed using mind body techniques.
Yeah.
So that was very uplifting and it felt very hopeful for me to read her book. And I also am a big TED Talk person. I love TED Talks. And I've listened to Lisa Rankin's TED Talk about the placebo effect as well. And she's not sponsoring us either. So I really enjoyed her TED Talk. And there's a lot out there which I want to hit on about perception of pain and perception of the idea that you can't change. And that's where I'm also a huge Joe Dispenza fan. And we do have the ability to change. And we do have to change our personality in order to change by just basically breaking habits. And we can create a new perception for ourselves. And I'm just going to hit on this one study of two twins. And they were born and they had an alcoholic parent. And one twin grew up to have alcoholism and to struggle with that in his life. And the other twin grew up to become a CEO of a company and not become an alcoholic at all. And when they were both asked why they became a alcoholic and one was asked why they didn't become an alcoholic, their answer was exactly the same. They said, because my father's an alcoholic. So it's very interesting that you can shift your own perception of things to create the reality that you want.
Right. That's so interesting. That's so like that makes me think of the nature versus nurture, right? Like two siblings can grow up with the same exact environment, but how they perceive it has a different effect in who they become and how they respond to it. So interesting.
It's how people perceive stress.
Mm.
If someone perceives stress as being hard and hard to deal with, and this is going to be a hard lesson, or someone perceives stress as this is going to be exciting. So it's all in the mindset. And you can create this mindset basically with anything in your life. You can say to yourself, oh, I have to go to the gym because I need to lose weight and I need to get healthy. Or you can change that around and say, I get to go to the gym and I love having a healthy body. So it really makes a difference how you perceive the activity to what's going to happen in your physiology.
And that's one of the reasons why I incorporate affirmations, right? And people just think, oh, affirmations, you just repeat it and it's supposed to do something. Well, yeah, it is eventually because we're changing the mindset. But affirmations isn't the one thing we're doing, right? I'm very big on getting at the mindset. What is the root cause of why you are the way you are? And then what is it that we can change? And that's not for me to determine, that's for you to determine. But what is it that we can change? And then how are we going to do so? I'm going to bring it up again because I always do. Meditation is one of them, journaling, affirmations, yoga. There's so many different ways of doing that and changing your mindset. But it all starts with awareness, being aware of your mental chatter. Really, how is it that you speak to yourself? Why do you speak to yourself that way? And then changing that slowly. It takes time and it takes work. It is not easy, but it is doable. I shouldn't even say it's not easy because there I go telling people, right? And giving them expectations. It is easy. It can be easy. It just takes work. And that work doesn't have to be a negative thing. It could be, I get to do this work, right? Like you said, I get to versus, oh, I have to.
And you made a really good point because how do we change this about ourselves? And the first thing is awareness.
Step one, always.
Always awareness is the first step in changing yourself. And I'm going to plug another book right now, The Warrior Heart Practice by Heather Ashamara. And it's something that I really live by, her methods. And one of the methods that she talks about in her book is stalking yourself.
Mm-hmm.
And it's actually pretending almost you can be an eagle and you're looking at yourself from above. Sometimes I look at myself like a lion because I find the lion is my spirit animal and it's what I see when I close my eyes for some reason. So I use this method to actually stalk myself and say, I wonder what I'm really thinking. What's really behind that thought? And when you come to that awareness, that's when you can change your mindset and dig deeper into the rooted belief.
Right. And to plug someone else, Edgar Tolle talks about the ego. I mean, he's not the only one. I'm bringing it up because I'm rereading his book, A New Earth, all over again. And he talks about the ego, just being aware of it. Once you are aware of it, it almost breaks that unconscious thinking, right? You can't be aware of your ego and still be living from your ego.
And it's bringing the subconscious to the conscious level
Yes.
because 95% to 97% of our activity in our brain is we're living in the subconscious. So as soon as we can bring awareness to it and bring the subconscious to the conscious, that's when we can bring change and change our mindset.
Yeah. And that's where that title, Joe Dispenza came up with his title, Breaking the Habit of Being Yourself. Because one, you're aware of it. And once you're aware of it, now you can go, huh, I've been doing that for so often. Can we do something different? You have choice now, basically, is what he says. Once you're aware of it, you have choice. Do I do the same thing or I do something different? And that's the action. That is the action that you take. So that's why we say it's more than just positive thinking. It's more than just mindset. There's action that goes along with it. And I'm going to shamelessly plug myself. I have a deck of affirmation cards, and I created this deck for this exact reason. You pull a card and you repeat the affirmation throughout your whole day or for the whole week or whatever you want to do. You journal on it, you come up with examples of how you are using this affirmation. And before you know it, you actually start to live this affirmation. Oh, wow, I caught myself noticing my body. That's one of them. I caught myself noticing the messages coming from my body. And some of the programs that I have on my website too, as I mentioned the last time, the clear intentions, right? It is diving deeper into your subconscious beliefs. It is using journaling, it uses affirmations, and it uses meditation. I like to do those three. Those are my methods: affirmations, journaling, and meditation, because that's how you bring the subconscious to the conscious.
Exactly. And one of the things I do, and I'm a big fan of affirmations, I use them all the time, is I have my clients set an intention for the day.
Yes.
Because if you know about the reticular activating system that brings data into our brain and it brings the data in that's most important to us. So it does it know what's most important to us? It's what we focus on because
Mm,
I'm sure some of you out there have went to buy a new car or went to buy a new used car and all of a sudden now you see more of them on the road. They were always out there, but it's what we're going to focus on. So if you focus on your affirmations and your intentions for the day, the universe will bring you more of that into your awareness.
yeah, right. And even if it doesn't feel true at the moment, it may have been true at some point. Use that to your advantage, right? And that's where the not yet, right? Did you talk about that?
I didn't talk about it yet.
Let's
Not
get,
yet.
let's talk about that. Right? It may not be true in the moment, but knowing that you're moving towards that is still better than, "Ah, I'm just stuck this way," right? And it just being done and over with because you've quit. You've quit before you even started. But having the mindset of this may not be true right now, but it will be at some point. It can be. And if you want to think like if you are like quantum thinking like me, where you're like time don't exist, past, present, and future are all the same thing. Time is not linear, right? It might not be accurate for me right now in this dimension, but at some point in some dimension, some timeline, it's true, then it's true for me too. Why not?
They've actually done a study with the power of not yet, giving children in school the grade not yet. And what they did was they would praise them on their effort, on their perseverance, on what they've been experiencing and how they've been experiencing it. And what they noticed was there was a greater improvement in their grades, and it created something called a growth mindset instead of a fixed mindset. So children that have a growth mindset can get, let's say, a set of math problems that might be extremely challenging and see them as exciting. And the other group of children that doesn't have a growth mindset, that has a fixed mindset, might see those math problems as stressful and scary and go on now to cheat and try to find the answer from someone else, or even try to find someone that didn't do as well as them on the information on the test. So, giving people and giving kids the opportunity to use the word not yet can actually promote a growth mindset and can have them more successful when they go out into the world.
That's so encouraging. That if kids can do it, we can do it too,
So all we have to do is think differently.
right? Everything starts with the thought. We don't have to believe the thoughts. We can question the thoughts, but when you're aware of it, again, you get to decide, do I want to continue following this or do I want to do something different?
Exactly. And one of the words, and we're plugging a lot of people today, but I heard this on Rob Dial's podcast, and he uses the word abracadabra. And sometimes, if you remember, we used abracadabra in magic tricks, but it's really not magic. The word abracadabra means as I speak, I create.
Hmm.
Let's speak it into existence and
Yeah.
let's start to create our own reality, all by just thinking differently.
Hmm. Again, another reasons why I love affirmations, because you're saying it out loud, right? You're speaking it into existence, and then take it a step further. What would it feel like for this to be true? What would it feel like in your body for this to be true? If you are really good at doing that, you actually start to produce all the hormones and all the things for your body to make it true. And then you start to notice all the things that are going to help you, and you move in that direction without even trying so hard because your physiology is already doing the magic for you. Your brain's doing the work and the magic for you, and you kind of just have to go with the flow, but continue being aware.
And some of these concepts that we're talking about today, we can let everybody know we're going to be teaching in Bali in November.
Heck yes, it's happening. Right. So I look at that as like an intensive workshop, right? Because you offer things, I offer things here and there, but this is like a week for us to spend time together almost 24/7, but it's like an intensive. It's not just a vacation, it's a experience. It's a transformative experience because you go home a different person. We both use techniques that are working at the subconscious level, bringing it to the conscious, right? We're teaching people how to do that. And I already mentioned I like to use meditation. I know you do that too, and hypnotherapy techniques to really change people. And we're not doing the changing. We're sort of just encouraging it. The change happens in you. You make the choices, you make the decisions. It all happens with you, and it's the work that you do. But yeah, I am really excited to do that because it's more than just a getting away vacation. Let's go to see Bali. It's really, we're all, myself included, we're all going to leave as different people. Isn't that exciting?
It is exciting because when I went before to Bali on a retreat, I definitely did not come back as the same person. And that's why I want to allow and invite others to experience this because you can really, there's, I don't know, something special about Bali. And there's just this healing that can take place there that makes it a little easier than, I don't know, the rest of the world sometimes. So I am really looking forward and putting all of our techniques together to create a healing retreat for people with pelvic pain or other conditions,
Right. With anything, even if it's emotional, whatever
even
it is.
if it's emotional.
You'll come
Exactly.
back a different person. And I do believe that there are some places that, whether you want to believe it or not, there are some places where you cannot deny that it just has a different feel to it, right? And that could be your sixth sense picking up on there's something different about this place. You might not be able to pick up exactly what it is, but you can recognize it's different, right? And when some people go on vacation to certain places, they're drawn more to certain places for that reason. It just has a different feel. There's something there that's drawing them in more and more. And I feel like overall, from what I've heard, I've never been there, but I've heard that Bali in general just has that vibe and that frequency. So I can't wait to experience that. I cannot wait to experience that.
I can't wait to experience it with you. It's going to be absolutely amazing. I think it would be a good idea to maybe challenge our listeners right now. And when you hear this, and in the morning or at night or throughout your day, picking an affirmation or setting an intention and giving it a try for a week or two and notice and see what happens in your life. I guarantee there'll be some changes that you can look forward to and let us know how you do.
I totally agree. I'm laughing because I remember what got me into all of this space in the first place was Oprah. Oprah Winfrey has been my teacher. She don't know it yet, but she has been. I remember one episode she talked about writing down something that you want. And she said, just start with three things. Keep it small. You don't have to believe because people have hundreds of things, and then it's so hard to focus on that. I had to start really small to believe it for myself. Write down three things, or even one. Keep it real simple, but write down one to three things that you want. Even if they feel outlandish and far away, just write it down. Write down three things that you want. And at some point, you're going to go back and look at that list and go, oh my goodness, it happened. I got the things. And I'm laughing. I laughed when you said that because I didn't believe any of it. I really didn't. I was so skeptical. I was like 20, if that. I was so young. And I was like, I don't believe any of this stuff, but I'm gonna try Oprah because Oprah told me to. And I wrote down three things. And I remember when I went back and I looked at it and I almost fell off my chair because I was like, wow, when I thought those things were so far away and so impossible, it actually happened. All three. I got excited and wrote three more things and it happened again. And I have been doing this ever since. I keep it small. Some people have like a list of so many things. I can't keep track of so many. So I keep it really small and I write down one to three things. And when they happen, I go back and I add more because it's proof to myself. And each time I write something out, even though it feels so crazy impossible, in my mind, I know it's happened before, it can happen again. And that is one of my affirmations, right? That could be the affirmation itself. It's happened before, it can happen again. Just try it. Write down one to three things that seem crazy, but write it in the positive and present and see what happens.
What a great technique. I love that.
Thank you, Oprah.
Well, maybe Oprah will come on our podcast soon. We'll see if she's listening to us right now. Oprah, we'd like to have you on our podcast.
Let's write that one down.
Let's write that down. Exactly. Perfect. So I
Yeah.
hope today we gave people a good understanding of the placebo effect and how powerful it can be for our healing. And I actually hope too that they'll utilize some of these little techniques that are really easy to implement.
Use the placebo effect for your benefit. Use it. All right. So thank you for joining us and tune in next time. And definitely let us know if you have any questions, if you want us to discuss anything specific. And please do share your affirmation with us. If you'd like to leave us a message or ask a question, please check the show notes with the link so you can reach us directly or email us at beyondthepelvis@gmail.com.